Hello, everyone. Welcome back to Autism Demystified. I am your host, Dr. Vladimir Baryev, a general pediatrician specializing in autism. And today we have a fantasticacious, wonderful, graceful guest, Dr. Katrina Coulter, who is joining us to discuss the microbiome and the way that it relates to autism and to overall health for us as human beings on this beautiful third rock from the sun, planet Earth. Let me tell you a little bit about my wonderful guest. Dr. Katrina Coulter is a physician, mom, wife, regenerative rancher, content creator, and public health educator. She is double board certified in internal medicine and infectious diseases. That is a lot of training, knowledge, education, and reading. She completed her medical school, residency, and fellowship training all at the University of Arkansas for medical sciences in Little Rock. Dr. Coulter is in private practice in Colorado, where she treats a wide spectrum of complex infectious conditions in adults. Her approach to medicine encompasses the whole person, considering the interplay of all the internal body systems while also recognizing the influence of external inputs and environmental factors contributing to how infections manifest uniquely in each patient. Dr. Coulter strives to help restore patients to their optimal health with a particular focus on rebuilding and harnessing the microbiome to improve immune system function and resilience. You can follow her on YouTube at Katrina C-MD or check out her ranch up page at buckupbuttercupranch.com. All the links will be provided in our show notes. Dr. Coulter, welcome. How are you today?
I'm doing great. Thanks for having me, Dr. Baryev. I'm so excited to be here. I love what you do. I think it's so important, and I'm really excited to have this conversation today.
Thank you very much for that. Our conversation today was based off of a very fascinating study that you sent me. And when it comes to research studies, I love them. It is one of my favorite treats in the world to get to read and dissect them. So, can you tell us a little bit about what is the current state of the scientific knowledge on the relationship between the microbiome and autism?
Yeah, I'd love to answer that. So, we're in a really exciting time in medicine where we're starting to really understand the interplay of the microbiome and a lot of different diseases. And so for your listeners that aren't really familiar with what the microbiome means, that is the trillions of bacteria and fungi and even viruses that live in your intestines. So you have more of these foreign cells essentially than we have actual cells in the body, and we are realizing that they are absolutely influencing so much of our life and how genes are expressed. And so in regards to autism, we have really started to understand the gut brain axis. And so that is the interplay of the what's going on in the intestines to what's going on in the brain. And that interplay is occurring through the vagus nerve, which is our 10th cranial nerve. And so it's kind of a two-way street. So the brain is telling our intestines things like, okay, it's time to move and digest your food. And what the intestines are telling us through the microbiome is, hey, everything's cool and okay in here, or things are not good. Things are, it's getting kind of wild in here. We're having a party, everything's getting out of control, or I'm not getting enough of the right nutrients, or I'm not producing the right nutrients. And so our understanding of that gut-brain axis is where we're starting to understand the effects or the contribution of what's in the intestines to the development of things like autism spectrum disorder. And
Okay.
so the article that I sent you was looking at really metabolites that are produced by bacteria, and looking at those metabolites in things like cord blood. So when a baby is born, sampling to see if these metabolites or there are present or are they absent, and then following these children out to who develops a neurodevelopmental disorder and who does not. And so what we found was that there's a predictive metabolites. And that goes further into these things are present when the child is born. So these are metabolites that are actually going to be produced by the maternal microbiome. And so the maternal diet is affecting the neurodevelopment of the infant, which is really, really fascinating.
Yes, absolutely. And it wasn't only for autism. There were, I think, ADHD, and there was another condition I forget now that was mentioned as well. Just a range of neurodiverse conditions that were impacted by this.
Yes, and actually, this study didn't address it, but in some other studies, we found that the microbiome is also influencing develop of neurodegenerative diseases in older adults like Parkinson's and Alzheimer's through the same gut-brain axis. So it's really kind of this missing link that I feel like we've been looking for, and intuitively we've kind of suspected, and now we're starting to finally look for the right things, the right molecules to test. And so thinking forward, this could help predict that a child might need a little bit of extra intervention earlier on, instead of waiting until you see some of these traits at the ages you typically would start getting referrals.
I see. So, very early on in life, having more surveillance of these children and giving them more resources to detect things upstream would definitely be beneficial for their development if we had a reliable test that we could do for them, knowing which children were at increased risk. Absolutely, that would definitely revolutionize the outcomes that we see in autism, because we know the earlier that we intervene, the better the outcomes that come about. And it actually improves the conversation that we have with families, because then we are able to point to something with an actual test. Like, here are your test results, and here are these metabolites that we found for yourself and for your child. And this is what the results of that means. So there are currently families that are asking about the use of probiotics in children on the autism spectrum. How does this study show results that may not be linked to the use of probiotics, or may be linked to the use of probiotics from your standpoint?
Yeah, so I didn't feel like this particular study really helped support that. It more was able to identify something earlier on, but there are other studies that definitely indicate that trying to manipulate or modulate the microbiome in patients with autism spectrum disorder can improve outcomes. And so probiotics is often a question I get asked all the time as an ID doctor. Just, I mean, several times a day, people want to know, well, which probiotic should I be taking? And the problem is this kind of reductionist medicine where we want to just go to a pill and take the pill and fix the problem. And what I learned in my training with infectious diseases was like, yeah, probiotics are great in theory, but they don't really pan out in the studies. And I think we see some promising benefits in the studies with autism, but not necessarily that they're a cure. And here's the reason why. Because probiotics are just putting these active bacteria in the intestines, and hopefully you're absorbing it. But if you are not providing the foods that these bacteria want to eat, they're not going to stick around. So that's where prebiotics come in. And prebiotics really are just insoluble fiber. So it's going to be things that you find in like onions and garlic and asparagus and barely ripe bananas. So it's in a lot of foods that we could eat regularly. But if you just put in the probiotic and you are not introducing the prebiotic foods, and again, those you can buy a prebiotic pill, but how much fiber are you really getting in a capsule? You have to plant the whole garden. You can't just put the seeds down and expect them to grow when there's no soil. And so you really need the prebiotics with the probiotics. So it takes a dietary change. And I know in patients with autism that often there can be like a gastrointestinal component. Children can be very picky about food and textures, and so there's a lot of challenges associated with that. Um, but but really figuring out how to introduce that fiber is the step before the probiotics. And then do you need a probiotic every day? Probably not. You wouldn't plant seeds in a garden every single day. Once you get it planted, it will take off if you have the right environment there. And I'm going to take it even a step further. These metabolites that we're studying are really now postbiotics. So these metabolites that we're finding are different, are the postbiotics or the products made by these good bacteria in the gut. And so you can get prebiotics, probiotics, and postbiotics all from food and from eating fermented foods. So things that young kids may not be really excited about, like sauerkraut or kimchi, but then there are other things that kids will eat, such as yogurt and cottage cheese are great sources of prebiotic, probiotic, and postbiotic. And so you're getting not just the bacteria, you're getting the food they like, you're also getting their products that they've made all in one serving.
Now, one question that this study answered for, at least partially answered, we would like to see this reproduced perhaps in the future, even though this was a wonderful study because they followed people for 20 years and their records, which is not something that's easy to do. And it's very resource intensive to do something like that. So we take the results of the study very seriously in the way that it was designed. The question was always, is it because children with autism eat differently and have different dietary preferences and patterns that causes them to have these changes in their gut microbiome, or is something happening beforehand that is prior to them having specific dietary preferences that is the reason why children with autism also have gut dysbiosis or a different microbiome living in the intestines? And this study helped to point to the latter as explanation, that this happens before they develop those symptoms, which is very fascinating. It goes to show that it's not only about what they're eating going forward. It may be continuing that dysbiosis going forward, but there was something there to begin with.
Absolutely. I absolutely agree. And I think it points to maybe that we should be focusing more on the maternal diet and what we're telling pregnant women they should be eating. And certainly no judgment here. I have two kids. I didn't have the best diet when I was pregnant. I didn't feel well. You're hungry. You kind of have this attitude of like, hey, I'm putting these pounds on regardless of what I do. So is it really a big deal if I, eat this ice cream or this hamburger or whatever, unhealthy choice that you make? I've been there, and so no judgment. But I do feel and there's plenty of data to support this. Our diet is being overtaken by ultra processed foods, and we've been introducing these since the 70s, and they've just been ramping up ever since. And ultra processed foods are essentially foods that are going to contain 7 or more ingredients, and the ingredients are going to be things that you normally wouldn't have in your kitchen. So things that you look at on the label and you have no idea what that is. They're added for flavor, they're added for shelf life, added for all kinds of reasons. But what we're taking out of the foods to add those is the actual nutrients. So it's like we're eating sawdust essentially. Um, and so really focusing on our food system overall is important, but also focusing on education to pregnant women as to how what you're eating now will affect your child's development, I think is an important area where we need to put a lot more resources and a lot more focus.
Absolutely. You know, the rebuttal that a lot of uh, food suppliers give is that they worry that shelf life of certain foods will be affected if additives are not placed. That we would have to worry about shortages in the amounts of foods that we have available to the population unless they are processed and modified in certain ways. How should they? On the other side, we worry that this is impacting human health and wellness. So, how should we go about advocating for a more common sense approach to, we there are like, for example, give you one example, even with something like genetically modified food, genetically modified organisms. So we need some resistance of these foods against certain parasites and certain fungi to prevent a shortage of certain crops, because there have been crop shortages in the past from natural species of crops that have grown in society. So where do we find the balance of having enough food to feed the world and not modifying it so much that it's causing negative health implications?
Yeah, no, that's a great question. And it's a really tough question because there are reasons why we've industrialized our food system. It's to feed the masses. But I argue that we're actually weakening our population by eating these foods. And so in the United States here, we have an overnutrition problem. We don't have we can have malnutrition and overnutrition at the same time. And so you're getting these foods that you think are sustaining you, but they're full of sugar, they're full of these preservatives. And are they really doing your body any favors? Do we need to have at the checkout line at the grocery store or whatever store, do we need to have an aisle of candy bars so that your child can have a total meltdown, as you're just trying to get through to the end? We don't need these processed foods as much as we have them. A lot of them are convenience. Potato chips do not need to be a meal. That doesn't need to be part of dinner. And so we do need to go back to simpler foods, essentially. So the closer a food is to how it's found in its natural state, like an apple, is going to be better for you than in some sort of processed form. And I absolutely agree. We have issues with you know, crops being wiped out by plagues of pests and things. But if you look how nature grows food, it's not in a monoculture. And so when you grow fields and fields and fields of the same product, the pests are going to come and decimate your product. And
Mhm.
so there needs to be more diverse planting. And there's a lot of different approaches. We have the technology. We're smart. We can do it, but it's just easier with the systems that we have in place to keep doing what we're doing. For example, we don't need fields and fields and fields of corn that we then have to figure out what to do with to make into some sort of sugar that then we hide into food or something along those lines. You track in with me?
Yes, absolutely. I am there. I was just you had me start thinking about just how much cheese was infused into our diets because we had an overproduction of dairy at one point, and corn and all the different corn products like high fructose corn syrup that is introduced to our diet just to have the demand meet the overabundant supply. not the other way around. And absolutely. So to summarize for our listeners, rather than taking the approach for what we can do for our own health, rather than taking the approach of I can solve an abnormal microbiome that I or my child may have by taking a probiotic pill and the pill should fix everything. There's a more holistic approach to thinking back towards the simpler and more just rational, whole food, plant-based approach of eating a diet filled with rich fiber, as well as some probiotic promoting fermented foods like yogurt and cottage cheese. Is that what I'm hearing you say?
That's absolutely it. Is start trying to replace the processed foods in the diet with whole foods. So an example, a trap that I fell into with my kids was those little gummy fruit snacks, because they say fruit on them. There's no fruit in them. They're totally processed. They're terrible, but they're so convenient because they come in these little
Fruit in
individual
quotation.
packages. And then you don't have to worry about allergies in your kid's classroom because they don't contain any nuts, but they're terrible. And my kids would eat like 3 or 4 bags of them and say, we're still hungry, we're still hungry. Whereas if I can just get them to eat a banana or an apple or an orange or something, they'll leave me alone because now they've filled up on fiber. They've gotten that sweetness they desire. They've gotten all the phytochemicals from the fruit. And sometimes as a parent, it can be frustrating because you spend all this time preparing your kids this, healthy meal, and then they're like, well, can I just have mac and cheese and dino nuggets? And it's like you put all this effort into it, and you have to play around a little bit. Like I found sometimes my kids won't eat an apple, but if I slice it up with my mandolin slicer and I put it in the food dehydrator and make apple chips, they'll destroy it. I mean, I'll put 10 apples in there and they're gone within a day. But 10 apples would not be eaten in my house within a day. And it's the exact same thing. I'm not taking anything away. I'm not adding anything to it, but it's the texture. It's changing it. Now it's a chip. Now it's more fun. So there's all these little hacks that you can work on as a parent to try to get these foods in, but you just have to be mindful of where are these processed foods and what can I replace it with? And it can be very overwhelming as a parent. There's all these things that can be terrible, and it's like where to even start. But if you can just start with one little thing, taking out the gummy fruit stacks and replacing it with something a little bit healthier, that's one thing you've done for your child. And what I think is so exciting about the microbiome is it's modifiable, right? So it's not saying, oh, you have this disease and that's your sentence. Those are the cards you're dealt. Good luck. It's saying, okay, the bacteria inside of you are not really the ones you want. So you can make changes and get the ones you want, and hopefully modify some of the more problematic parts of things like autism to where you can utilize the more positive aspects of autism. I've heard you say, Dr. Vlad, that it's like a particle and a wave. And I think that's such a cool way to look at it, because I do think there are definitely some blessings conveyed with autism spectrum disorder. And instead of looking at it as a problem, we should say, okay, how do we enhance those things, but how do we minimize the socially problematic portions of it?
Absolutely. I have a very important and topical question that families have come to me with is there are at-home microbiome kits that you can mail away. I just wanted to hear your thoughts about this type of testing and whether the results of these tests are useful, actionable, or if we could achieve the same outcomes without having to take those approaches.
Yeah, right now, my opinion is save your money and look at the diet. And you can make you can easily get the information on the good foods that you need to introduce into the diet without taking the test. And then, taking the test again and the test again. Those I think may be helpful at some point in the future, but right now we're just in kind of a data collection mode with that, where there are some practitioners out there that feel that they can really guide people doing that, but I think that your patients' families can just as easily modify the diet. And I will just play on that with, there's also fecal microbiota transfer, and I don't know if anybody's approached you about that.
Not yet.
Okay. And you can decide if you want to leave this portion in or not, but so that's something that we use quite frequently in infectious disease for one condition. It's FDA approved for one condition, which is Clostridium difficile diarrhea. But essentially what it is taking the feces from one human and transferring it into the GI tract of another human. And so there have been some studies with autism that have shown some promising results, and there have been patients, it's not approved in the United States, that have gone to Europe for this. But what the downfall of that is that it's, in order to maintain the benefit with autism, it seems to need to be done over and over. And so again, I suspect it's because we're not changing the diet. We're just trying to fix it with this transfer, and the desirable bacteria aren't sticking around because the diet isn't changing. So it's a very drastic intervention that's not really getting the results that are desired, when I think there's a much simpler intervention of really drilling down on the diet and focusing on the foods that your child is getting.
Now, I also happen to have a personal opinion about our body's microbiome, and it goes back to my approach on healthcare overall. In that, and I have a question for you. I'm curious to hear your perspective on it. Is that there are other factors aside from what we eat and what our mother ate while she was pregnant with us that will affect our microbiome, things like stress and sleep and physical activity as well. Outside of improving our diets, which is very important, those do you discuss those other tactics to improve microbiome health with families as well?
I absolutely do. Absolutely do. Because you're right. There's a lot more to it. Food is something, we're consuming multiple times a day. So that's an easy intervention for me. But in my line of work, I am prescribing antibiotics all day long. And so they very much affect the microbiome. And as a pediatrician, I'm sure you've dealt with situations where a child has a virus, but a parent really wants an antibiotic, which is not going to affect it. And so your role sometimes as a pediatrician is to say, this actually is probably going to cause more harm than good. Sometimes that's my role as an infectious disease doctor, is to say, I know that 7 other doctors have given you 17 other antibiotic prescriptions, but I'm here to be the one to say an antibiotic is not what you need right now. So antibiotics are a big one, but we also know that things like NSAIDs, such as ibuprofen, can affect the microbiome. Proton pump inhibitors have a big effect on the microbiome. Both of those are available over the counter, so people can go and get those anytime they want.
Ibuprofen and your Prilosec.
Yep. Movement. This is a really cool one, how movement increases expansion of those desirable bacteria. So even 20 minutes of exercise really helps promote those colonies. So that's a big deal. So I'm always encouraging in my patients that they get some sort of movement. It doesn't have to be like hitting the weights hard at the gym. It can be something as easy as going for a 10 or a 15-minute walk. So those definitely affect it. How much water you're drinking is going to affect your microbiome. Absolutely stress. And stress is a tough one in our modern society, to really get people to recognize how we're living in this constant stressed out state that our bodies really weren't designed to live in. So we have this high cortisol state that's modulating the microbiome, and the microbiome is our training ground for our immune system. So in my line of work, patients are always coming and asking, am I immunocompromised? What can I do to enhance my immune system? And so I really focus on all these different interventions of how can you enhance your microbiome to enhance your immune system. And sometimes it's something as simple as, yes, you just need to get 8 hours of sleep. You need to put the phone down. You need to quit the blue light an hour before bedtime, and just these really simple interventions absolutely are affecting our overall health.
Look at that. We can help people with their health without having to prescribe anything special or fantastical out there. I thank you so very much for your time today, Dr. Coulter. I'm going to make sure to include links to your available resources, as well as the study that we mentioned. And I would love to hear, how can families learn more about you and what you do and find you further?
Sure. Great. Thank you, Dr. Vlad. I currently have a YouTube channel. It's Katrina C-MD, and I'm talking about a lot of these things about different foods that you should be trying to get into your diet. And I have a series that I'm working on right now on the microbiome, delving into different topics, how sleep relates to it, how exercise relates to it, and all these different things. And so if that's of interest to you, come check me out on YouTube. Hopefully you found this helpful, and yeah.
Thank you so much, Dr. Coulter. I know I definitely found this helpful. I will be subscribing and watching all of your content and continuing to binge on it, as I already have started. So thank you to all of our listeners today and viewers. Once again, my name is Dr. Vlad, your autism expert, for all families who are looking for a physician who will help them navigate autism in their child in New York State. You can contact my office through our website at thebdpc.com. And everyone, have a wonderful day.